Good afternoon, and thank you for joining us. Let's start with the numbers. As of today, 2,516,716 doses of COVID-19 vaccine have been administered in Wisconsin, and 934,823 people have completed their vaccine series. Last week, Wisconsin vaccinators administered over 300,000 doses in 1 week, 311,360 to be exact. In mid-February, we were at 200,000 doses a week, and it was just 2 months ago that we hit the 100,000 per week milestone. As I said then, we were building the infrastructure and vaccinator network to make this kind of progress possible, and now it is paying off. We can see progress in our vaccination rate. Over a quarter of Wisconsin residents have received at least 1 dose, and over 50% of our 65 and older group has completed their series. In the past week, we have added more pharmacies to the federal retail pharmacy program, including Walmart, Meijer, and some hometown pharmacies. Community-based vaccination clinics were already up and running in Rock and La Crosse County, and this week a community-based vaccination clinic opened in Racine County, and as of April 6th, we'll add Marathon County to the list of community-based clinic sites. I'm proud to say that I had the privilege of serving as Marathon County's public health officer for a number of years. And in fact, when I was there 15 years ago, we ran a mass vaccination clinic as part of our pandemic preparedness exercising. We worked in partnership with 13 other counties and 2 tribal health departments on that scenario. So I can assure you that Marathon County knows how to do this work in partnership, this time with AMI Expeditionary Healthcare, North Central Technical College, and area health system providers. With these vaccination numbers and the progress we are making, we can't forget that COVID-19 is still very present in our state. We are adding 537 new cases today, which brings our total confirmed cases of COVID-19 to 574,436 people. Our 7-day average of cases is 459. Today, we are also reporting 2 more Wisconsinites have died from COVID-19, which brings our total number of deaths to 6,599. Our thoughts are with the families and friends who have lost loved ones, and we must each remember it's our responsibility to do our part in stopping the spread of COVID-19 to prevent further deaths. That means masking up whenever you're in public, even if you're fully vaccinated for now, and continuing to physically distance. I know spring break is here and almost here, depending on where you live, for many kids and many families, and that there are a number of important holidays around the corner that usually bring families together. Remember, the safest place to meet is outside. If you want to walk through more information about how to be safe as we continue to vaccinate, please visit dhs.wisconsin.gov/COVID-19. The You Stop the Spread icon will take you to detailed guidance on best practices for you depending on your vaccination status. Thank you for all you are doing and continuing to do to stop the spread of COVID-19 in Wisconsin. And with that, I'll turn it back to Elizabeth and welcome your questions.
Thank you. And a reminder to maintain audio quality, please remain muted until it's time to ask your question. If you're on the phone and you are able to do so, use *6 to mute and to unmute. And we begin today with Chase McNamara at WAOW in Wausau. Chase.
Thank you for taking my question. State Republicans have criticized how long it took to update numbers from the unknown housing setting to a specific setting. Why did it take so long? And does the department believe the state should move to a more top-down statewide reporting system to help with consistency rather than have 72 different entities do things 72 different ways?
Well, Chase, I think you just heard I used to be a local health officer, and so on that account, I just want to say I am deeply appreciative of the work that our local health departments do across our state in not only through this pandemic, but in their work to protect the health of Wisconsin citizens every single day. As we've explained previously, we have been doing a number of activities to review our data and improve our data. This is normal part of what epidemiologists do as they track diseases in our state. As I've said to some folks, what you're seeing now is kind of the inner workings of our epidemiologists that usually are quite invisible to people, because usually this is the process goes that diseases are reported, we do the investigation, we do this kind of reconciliation of data before we ever publish it, and then we publish a report at the end of the year. But in a situation like this where we were taking data into our surveillance system and pushing it out to the public as quickly as we could, because we knew people needed this information to make decisions about how to behave and what policies to put in place in local communities. We pushed it out as quickly as possible. We pushed it out while we were experiencing very high rates of disease. And everyone was focused on supporting people in local communities to react to the pandemic in the most effective way possible. And now we're going back and doing the kind of reconciliation and cleaning that we normally would have done before you ever would have seen the data. So what you're seeing now, as I said, is what normally happens. And you're seeing it in this staged way because of the incredible volume of data that we have to deal with here. I know we talk about what a monumental task, immunizing 5.8 million people when we can do everyone, and 4.6 million adults right now is, but it's also a monumental task to manage the millions of pieces of data that have come into our department, millions of tests results to review, hundreds of thousands of cases to review. Every case interview has dozens of questions. So the amount of data that is being reconciled at this point in time is far beyond anything we've ever done. And I just want to give a huge shout out to my colleagues across the department who believe in the accuracy and the transparency of data and are doing everything they can to make it as clean and accurate as possible.
Thank you for that. The next question goes to Scott Bauer at the Associated Press. Scott Bauer.
Hi, thanks again for doing this call. Julie, just wondering if there's any thought being given to moving up the May 1st general eligibility date, and whether the recent uptick in positive cases makes changing that May 1 date more or less likely.
Well, Scott, we're constantly evaluating where we are at in terms of vaccination. As you know, it's only been since Monday that we started with this new group of over 2 million people with chronic diseases, and they are, of course, people who are at higher risk than the general population. And so we certainly want to give time for folks with these chronic diseases to get into the vaccine system, to make appointments. We also want to watch where we're heading with vaccine supply. As I've mentioned previously, the federal government has promised that vaccine supply is increasing. That's why President Biden indicated May 1st would be the date we'd have adequate supply to move faster into everyone being eligible for vaccine. And we're starting to see that. Our vaccine supply for next week, as I mentioned to you, we've seen very very low amounts of Johnson & Johnson since that initial shipment we got in early March. And as promised, we're seeing higher levels of Johnson & Johnson promised to us next week. We'll be receiving about 35,000 doses of J&J, so that's a net increase in our vaccine supply. We'd like to see a little bit more than that before we're ready to move to the general population. So we continue to evaluate, and we will keep you posted.
Wonderful, thank you for that. Now to Rob Sussman, WTAQ in Green Bay. Rob Sussman.
Hi, thanks for taking my question. Deputy Secretary, if I were a family who may be weighing spring break plans, most people in my family are either vaccinated or at in a very, very low risk category for COVID-19. What would be the argument from DHS as to why I shouldn't travel? Thank you.
Well, the argument about why I give you great caution of traveling is that as a nation, we are still at very high rates of disease. And as we've been speaking of, we know there are variants of this virus emerging and spreading across our nation. And so while you may be low risk or vaccinated, you can still become infected with one of those variants, or vaccine doesn't provide 100% protection. So when disease levels are high, if you don't have full protection, you may be more susceptible to disease. And we would want to caution travel because we don't want to be bringing variants into Wisconsin that could spread to other folks when you come back who are still susceptible. We're making great progress. I'm very proud of what's happening across the state. But even with our great progress, we're only at about 25 to 26% of people who have received one dose, around 15 to 16% of people who have been fully vaccinated. And we need to get these vaccine levels up a little higher before we risk bringing further disease into our state that will increase risk for those not yet vaccinated. So that would be the caution I would give one's family, is that I know it's been a long, hard year. I'm sure every one of us wants to go on a vacation. But if we can give this just a couple more months with the kind of progress we're making, I think we will be in a much better situation with protecting the whole of us by being more cautious in that regard.
Thank you. The next question to David Wahlberg at the Wisconsin State Journal. David Wahlberg.
Yeah, thank you. So we've seen an uptick in cases in the state in recent days and also in hospitalization. How concerned are you about that, and how much do you think that may relate to the variants?
Yeah, well, we know we'll be publishing more information about the variants on our website this afternoon. We'll have a whole new page on variants for you and the public to look at. I will say our current level of variants is we have 69 reported identified cases of the UK variant and one of the South African variant. But we also know a number of states in the nation are seeing significant upticks in cases and identified cases of variants, including our neighbors in Minnesota and Michigan. We know that these variants are particularly infectious, and we're seeing in other places younger people suffering from higher levels of infection. And so we are watching the number of cases very, very closely. You know, as I've said previously, we were never at a low level of disease activity. We have come down from an extremely critically uber high level of over 6,000 cases a day to the level we're at today in the 400 or so 50 cases per day increase. that is still very high. And our disease activity that was updated yesterday shows we're still over 100 cases per day per 100,000 over a 14-day period, again in the high category. So I think in a way, we've been lulled into a sense of security here in Wisconsin because we had it so bad that just having it bad doesn't seem too awful to us. So that goes to my answer to Rob's question too about why I would caution travel right now. We don't want to bring more variants into Wisconsin, and we don't want to take 5 steps back just when we're at the cusp of things getting a lot better. If we can give ourselves a little bit of patience, keep delivering 300,000 vaccines a week over the next, 8 to 10 weeks, we'll be much farther ahead than we are right now. So I hope that answers the question, David. We are definitely concerned. That's why we're still encouraging caution as we make this progress forward. It does not mean we'll have to do all these things forever, but if we can do them for a little bit longer, we'll be in much better shape than if we let another surge emerge in our state.
Thank you. The next question to AJ Bayatpour, WKOW in Madison. AJ.
Good afternoon. Thank you for doing this weekly call. Building on some of the other questions about the recent uptick in cases, yesterday in particular, there were more than 750 new confirmed cases for the first time. It looks like it's been about a month since that happened. Is there reason to believe that that was a clustering in data, or is there concern that there is a significant uptick in actual cases happening in the state? And if so, are there parts of the state that are of particular concern?
So again, this is about the pacing of information. So we are reporting cases to you on our website as soon as a positive PCR case comes in through the lab into our WED system, our epidemiologic disease and surveillance system. What happens next is exactly the kind of thing that you are referring to, is that our disease investigators throughout the state in local health departments, also supplemented with staff at the Department of Health Services, make calls to the folks who tested positive and learn more about their disease, where they might have been exposed, who else they might have exposed. That's the process by which then they identify if there might be an outbreak, if they see a cluster of cases at an employer, at a school, at an event that happened. And so that is all work that we will be focusing on and continue to focus on, just as we have throughout the pandemic. But that's work that will happen over the next period of time. And we don't have the day after we just had laboratory data reported to us. So you're asking all the right questions, as a good epidemiologist would. And we'll continue to monitor the spread of the disease, just as we have throughout the pandemic with these uptick in cases.
Thank you. Now to Eric Gunn at the Wisconsin Examiner. Eric Gunn.
Thank you very much for doing these calls. You mentioned or alluded to contact tracing, and I know several months ago that the number of cases versus the supply of contact tracers were so out of whack that we were really in a situation where you had to just people had to, often let people know themselves and so on. How well do you feel like the state, between the state and the local health departments, have caught up with the need for contact tracing, and what have you been able to do as a result, and what have you maybe still not able to do as much with that as you would if the case count was lower?
Yeah. So you're absolutely right, Eric. Just like hospitals moved into critical standards of care when we were experiencing the surge in November, public health professionals had to do the same thing. You know, if you remember, 6,000 cases a day, and even 700 cases pales in comparison to what we were seeing in the fall. So back in the fall, our disease investigators, first of all, you are right that many places were unable to do contact tracing. That's making contact with people who have been exposed to COVID-19. We always continued to do disease investigation, which was call the person who had been identified as infected with COVID-19. And during that period of time in October, November, December, throughout much of that period of time, we used an abbreviated interview form to get at the most critical information and had to forego some of the more extensive information. We're at a place that we've returned to much more of a state of normalcy, and our contact tracers across the state are able to do disease investigation, complete the full form, and in the grand majority of cases also make contact with contacts and make recommendations for them to quarantine through the appropriate period of time. So our state contact tracers are there for surge when local health departments cannot meet all of those needs. And we've been getting a few referrals from local health departments, but at a very manageable level. So we've been able to complete all of the disease investigations and all of the contacts on a regular basis. So our system is holding very well right now. I will say in a number of local communities, it's the same people doing contact tracing as doing vaccination. So that is a big part of why we have surge capacity here at the state. If we did start to see local surges, we would be here to help back up that local system.
Thank you. Let's give the next question now to Desiree Fisher, WSAW in Wausau. Desiree Fisher.
Yeah, this is Tony filling in for Des. We've been trying to address specific questions from our viewers, and one of those questions is which vaccine is showing the best protection against COVID-19 variants? Thank you.
Great. I'm going to ask Dr. Schauer to respond to that question.
Yeah, no, thank you. I think that's, it's a question that we get a lot. So which vaccine? And really, I think the bottom line is all three vaccines that are authorized for use are shown to be safe and effective. And I think you do more damage by trying to shop around or figure out where to get a vaccine rather than just availing yourselves to the ones that are available and you can receive an appointment from. It's really important that we not expand out the amount of time that we're unprotected and that you go ahead and avail yourself of receiving the vaccine. The data really is showing that when it comes to the important markers of protecting against severe disease, against death, that they all three are performing really quite well, and that really is the most important thing. And lastly, it's important to get vaccinated and not just to think about it or to do as much research or to search out and take that much more time and remain unprotected.
Thank you for that. Let's go now to Mark Leland, Fox 11 in Green Bay. Mark, Fox 11.
Hi, thanks for taking the call. And we're working on a story about rummage sales. With the spring coming, more and more people are looking to have a rummage sale like they have in the past. I'm wondering what your recommendation is for those wanting to hold a rummage sale, as well as the recommendation for those considering attending and going to a rummage sale. Thanks.
Mm-hmm. Well, here's the good news about most rummage sales, at least most of them that I see in Wisconsin. They're held outside, right? They're in your garage, they're in your driveway, and so they're largely outside activities. And so that's the first thing I'd say. Do everything you can to hold your rummage sale outside, because our risk of exposure is much less when we are outside than when we are inside. And then secondly, just like we've encouraged many of our retailers to do. Be cautious about how many people you have present at the same time. You might set an occupancy limit at your rummage sale, depending on the amount of space that you have to space out items, so that people can keep that important 6 feet of distance from each other. And of course, I wouldn't hold a rummage sale without requiring everyone to wear masks at this point in time. Our risk becomes greater the more we interact with people we don't live with. And so we all have to take measure, particularly for those who are not yet vaccinated, of how much time you want to spend out interacting with other people who you don't know. You don't know what kind of safety precautions they're taking. You don't know if they've traveled recently or how much they have to be exposed to other people in their job. And so that's a risk-benefit ratio that each person has to weigh for themselves. But when you go out, keep physical distance, wear a mask. We are not as worried about COVID spread on hard surfaces as we were earlier in the pandemic, but certainly keep your hand sanitizer with you and wash your hands frequently, especially after you've touched items. And those would be the biggest things that I would say to people as they think about their rummage sale to keep it safer.
Thank you for that. The next question to Bob Haig, Wisconsin Radio Network. Bob at Wisconsin Radio Network.
Thanks for doing a call today. I guess following up on the question about travel and reflecting the reality that our transmission rate is still not low, are there other activities that are really red flags for you that you would really caution people to hold off doing for another couple of months or so?
Well, Bob, as I was just explaining, it's really a function of how many different people you interact with and how many different people they interact with. And so if you think about the web of your social network, the smaller you keep it, the less risk there is to you and to others of you contracting the disease and spreading the disease. So that would mean large gatherings, especially large gatherings that have lots of people who don't come together from frequently from other places. That don't frequently get together, who would be mingling from a lot of other places for the first time, are the kinds of things that are riskier at this point in time. And again, if you're going to gather with other people, especially people outside of your household, doing it outside is much, much safer than doing it inside. So large gatherings I would avoid, and travel, the issue with travel is the same thing as I'm saying. You're going to interact with more people outside of your household who you don't know where they've been. You're also interacting with the people they've interacted with, and that is what increases our risk. I want to flip it around and say, so what are the things you can do? Gather with people in smaller social circles, especially outside. Good weather is coming. I am confident. It is great that we are progressing out of winter into spring and summer. So gathering outside is great. Outdoor activities, hiking, biking, water activities as the weather warms, all are really great opportunities as we move forward. And as more and more of us are vaccinated, we will start to be less cautious about these things. I know people have pandemic fatigue, so do I. But as we move in, through April into May, as we have more and more people being vaccinated, and we hopefully see disease rates decreasing as a result of that, we'll be in a place where we won't be harping on gathering together nearly as much, where we'll be able to slowly think about increasing your social network, having more time together. even being able to move inside, and those activities will become less risky.
Thank you. The next question to Sean Kirkby at Wisconsin Health News. Sean Kirkby.
Hi, thank you for holding this. I was wondering, I believe last week the COVID-19 vaccinations wrapped up at nursing homes across the state. I was wondering if you could talk a little bit about how that went and what was the uptick among residents and staff at those facilities.
That's a great question, and I'll turn it to Dr. Schauer, who I think has the latest information about our work with pharmacies and long-term care.
Yeah, so the Pharmacy Partnership Program, which is the vaccination of skilled nursing and assisted living facilities throughout Wisconsin, is continuing. We have finished nearly all of the skilled nursing facilities, so there's 353 of those that were participating in the program. And we're finishing up the assisted living, which nearly all of them have completed their second clinics. So now the two entities who are the pharmacies that are doing this, which is Walgreens and CVS, are going back and doing the third clinics for anybody who may have started the series late or maybe a new admission or a new admit. In total, we've administered over 190,000 doses through this program, and as I said, we're still continuing to wrap up. However, it's important to note that we were still seeing individuals starting the series at that second and even at some of those third clinics, so that vaccination still is continuing in those facilities. And we are providing vaccine to a number of different pharmacies to continue to provide the ongoing vaccination needs as these facilities continue to have new individuals admitted or they have new staff, so that we can keep up those vaccination levels. We don't have the exact percentages by residents and by staff. There was an MMWR that was published in early February that talked about the rates, but that was for the first month of the program. And so for that, Wisconsin did have, it was shown that I think our vaccination for staff was in the 40 to 59% group, and then residents were higher. So we look for more information and that to be updated, as we know the first month was pretty early in the vaccination piece.
Thank you. Our next question to Denise Lockwood, Racine County I. Denise Lockwood.
Hi, my question is around staffing, specifically around nurses who are administering shots. What is the overall infrastructure of the number of people, the nurses that you need versus how many you have at this time?
So it appears that we're doing very well across the state with vaccinators. And certainly as a nurse, I applaud my nursing colleagues who have stepped up. Many have stepped up out of retirement and said they wanted to be part of this effort. We also have a number of nursing students across the state who are assisting with vaccination clinics in their local community or traveling around the state to have this great clinical experience, and we really applaud them and their work on this. But we also, nurses are not the only ones who are eligible to be vaccinators. Pharmacists and pharmacy techs are able to vaccinate. The governor just signed a bill for dentists to be able to vaccinate, and other professionals can be delegated by a physician or a nurse to be vaccinators with appropriate training and supervision. So, for example, medics in the National Guard are able to vaccinate as well. So we are doing quite well with vaccinators. Dr. Schauer, if you have anything to add about supply, I welcome it, but I think we're in pretty good shape. What would you add?
Yeah, no, I think you're certainly right. I think it's important to remember that a clinic needs many more individuals other than vaccinators, and we have had good showings of people emailing us and saying that they were interested either to vaccinate or just to assist at clinics. And so, everything from registration to sort of traffic control and things like that, all of those different positions are really needed to ensure that a clinic runs well. And I think we've had a good response from Wisconsinites really wanting to help out in any capacity. So both from the clinical side and those other pieces.
Thank you. Let's give the next question to Emily Fannin, CBS 58 in Milwaukee. Emily?
Hi there, thanks for doing the call. My question is that today is marking the anniversary of the Safer at Home order when it went into effect. Now it lasted until the middle of May, but I was just wondering, can you reflect on how far we've come since then? And what's your prediction on when things might start fully opening again?
Well, I think we kind of lose track that in Wisconsin, we've been pretty much fully open since May in many, many communities. I know some communities have had their own safer at home orders, but compared to a lot of other states, we have been largely open. As I reflect on it, Emily, and I can assure you, a lot of us have been reflecting on over the past year and marking these anniversaries. We've certainly learned a lot about this this virus and the vaccines. I think when I think back to March 25th, 2020, we had no idea when we might see vaccine enter the picture. And I had a number of people say, we'd be lucky if we had any before 18 months, 2 years. So we've definitely beat that. We've learned a lot about testing. We've certainly been very successful as a state in making testing available to people throughout the state. We've learned a lot about transmission. I just was talking about how we've learned it isn't as prevalent on hard surfaces, but certainly very virulent from respiratory secretions. And we learned you could spread this disease when you didn't have any symptoms, and we didn't know that in the beginning as well. We've learned how hard it is to be apart from each other, and that has been very draining and very taxing to people's mental health across the state. I mean, honestly, I can't wait until I'm doing a press conference with you all in a room together, and I can see your faces and you can see my whole face. That will be an exciting day. But I also think, as I reflect on this, about the thousands and thousands of lives lost and the hundreds of thousands of lives disrupted by this disease. I'm thankful that many, many people have recovered without long-term effects, but I also know a lot of people who've gotten the disease continue to suffer from long-term effects. And I also think about all the people whose lives have been disrupted economically, the children whose schooling has been disrupted, and the loss of learning, even though our teachers have been incredible at adapting and doing their very best to teach online. So there's been a lot of loss in the last year, but there's also been a lot of learning and a lot of opportunity for us to figure out solutions to really tough problems, and that has happened throughout many systems and sectors throughout the state, and has shown how Wisconsinites come together to care for each other. So a few thoughts.
Thank you for those. Let's go now to Stephanie Hoff at WIS Politics. Stephanie Hoff.
Good afternoon, and thanks for taking my question today. How many COVID-19 vaccine doses are we getting each week from the federal government, and how does that compare to before, like a month or about a month ago or a week ago, however you want to compare it to the past?
Well, it's increasing. I can tell you that, Stephanie. I think, sorry, I don't have the exact numbers in front of me. We can get that back to you. But what I can tell you is we had a temporary bump in our Pfizer vaccine this week. So we were at about 94,000 Pfizer doses when we're usually at about 80,000. We have been getting about 56,000 Moderna doses each week for the last couple of weeks, and we're steady there. And then, as I mentioned earlier, we got a little over 34,000 Johnson & Johnson doses this week. So this is going into next week. These are doses for next week, will be the largest number of doses we've received yet from the federal government. As I mentioned, that one slight bump of about 17,000 doses of Pfizer was a one-time, so we'll go back to our 80,000. So the next week might be a little less than that. But we're doing well. I mean, comparison, throughout most of January and early February, we were receiving about 70,000 doses a week. So that's been a significant increase, and that's why you're able to see the kind of increases in the weekly administration of doses you see on our website. And let me clarify, when I speak about those doses, those are first doses of vaccine. And I speak in first doses because that's new people we can vaccinate. In addition to that, if you look at total doses we're receiving, we're receiving double that for each of the Pfizer and Moderna doses because we're getting the second doses from several weeks ago as well.
Thank you for that. Let's go now to Madeline Anderson at Fox 6 in Milwaukee. Madeline
So going
Anderson.
back to the question about moving up the May 1st date, at least 25 states have announced specific dates for when they will open up vaccinations to the general public before May 1st. So my question is, do you think other states are making a mistake and rushing to vaccinate the general public, or are they in a better place than Wisconsin to be able to open up eligibility to everyone? Thank you.
Yeah, I think every state are making these calculations as they go, and the dynamics in each state are different. We have different avenues for vaccine supply. We've had different phasing. We have different populations. We have different number of vaccinators. So it's really hard. It's an apples and to oranges comparison to go from state to state. And so as I said earlier, we continue to evaluate this, and we'll see where we are. And once we feel confident in the supply of vaccine that we're receiving and the pacing of vaccine, we will make a decision and we will announce it.
Thank you for that. Let's go now to Georgina Fernandez, WJFW in Rhinelander. Georgina, a *6 will mute or unmute your phone.
Hello.
We can hear you. Go ahead.
Hi, sorry. I was wondering, some of the community-based vaccine sites that we're seeing in Wausau, how is that going to help that vaccine rate go up, especially more rural areas?
Yeah, we've been placing our community-based vaccination sites around the state to increase access to various communities. As knowing you're based in Rhinelander, and having lived many years in Wausau, I always remind people that Rhinelander and Wausau are not right next door to each other. They're about as far apart as Madison and Milwaukee are from each other. But certainly our goal there was to place a clinic in the north central part of the state, and its location at North Central Technical College is a great location. The community identified that location, but it's really a great location because it's right off Highway 51 there, right off the highway. No one has to drive into the community, and so hopefully we'll make vaccine more accessible to people throughout the region, not just in Wausau itself. That is our intent, and that clinic will be open to people throughout the region. In addition to that, you know, in smaller rural communities where there is not as high a population, our health departments have been doing a fabulous job in many of those communities. Our pharmacies in communities, our health systems and clinics have been doing a great job. And we will continue to monitor who is lagging behind and who is having higher vaccine rates as we move forward in more generalized vaccination. And we will offer our mobile vaccination teams to also come to smaller communities and more rural communities throughout the state to boost their vaccination efforts as well. You know, I know in the upcoming weeks we have mobile vaccination teams in many parts of the state, including up in Sawyer County. I know there was one recently in Portage County. And we've been talking with folks over in the western part of the state. And so we'll continue to look at where more vaccine is needed and where more vaccinators are needed and respond as we move through this process. Just a reminder, it's a 9-inning baseball game, and we are only in the, you know, probably the 3rd inning. So we've got a ways to go to get to everybody, but we'll keep evaluating, just like the baseball manager does, about what hitter needs to be in, what pitcher needs to be in. We'll keep evaluating where vaccine needs to go, where we need to send vaccinators to be sure, no matter whether if you live in an urban or a rural area of the state, that you have access to this important resource.
Thank you. Next question to Tom Durian, TMJ4 in Milwaukee. TMJ4. All right, why don't we try Chuck Kornbach, WUWM in Milwaukee. Chuck.
Good afternoon. I've heard what you said about supply. Can you sort of give us a snapshot of a ratio of what eligible demand is right now to that supply? You know, a few weeks ago, City of Greenfield was saying 4-to-1 demand outstripping supply. Do you have sort of a statewide ballpark figure? And on a related note, do you recommend or advise against people traveling within the state to get vaccinated, say going from Madison to another community?
Yeah, in terms of demand, we're seeing a pretty constant request for about somewhere between 400,000 and 500,000 first doses per week. What I just described to you is around about 185,000 to 190,000 first doses a week. So it's a little better than 1 to 4, Chuck, but not quite 1 to 3 if I'm doing my math right. So we still have, you know, we're making great progress, but we are not yet able to fulfill everybody's full request each week that they make it. You know, about the traveling across the state, when it comes to the allocation that we make of the supply that comes into the state, we do a formula that is very focused on the population of each community. And so if you're going to a state-supported site, either at your doctor's office or a local health department or community vaccination clinic, and you're traveling a long way, you are getting vaccine that really has been counted towards someone who lives in that community. The federal retail pharmacies are a little bit different since they're receiving regular supplies from the federal government based on where the stores are located. And so, you know, my belief is I don't want unfilled vaccine appointments. And so if you're going in and seeing available appointments, we want people to get vaccinated, but I encourage people, we are continuing to get vaccine. We are distributing it based on a number of formulas, but largely focused on population levels within the state. And so there will be vaccine coming to your community. So I think a lot of it just depends on each individual's level of patience and concern about their own level of risk, and I think people can make good decisions on considering all those factors.
Thank you. Let's go now to Joshua Peguero, WBAY in Green Bay. Joshua, WBAY.
Hello, hello. Thank you so much for taking my call. I just wanted if you can expand a bit. You talked about the temporary bump you received in Pfizer vaccines. And I know there were a few clinics, at least in the Green Bay area, that received them. Can you expand on who got what in terms of this? Like how much did each clinic get, and where did it go specifically?
Yeah, we have over 1,000 vaccinators across 72 counties. So, no, I'm not quite sure how to help explain who got exactly what. If I go back to our allocation formula, though, I think that can help you understand how vaccine gets distributed. So each week we receive a certain amount of vaccine. And there's a number of things we've been looking at to allocate vaccine off the top of the formula before we start allocating it based on different components. So as we've said, we make sure every local health department gets a certain amount of supply. We make sure our federally qualified health centers and free clinics and tribal clinics that are providing vaccine to some of our most vulnerable populations receive the full supply they ask for. We are starting to make base allocations to the network of FEMA and community-based vaccination clinics across the state because they are serving regional populations, not just populations from one community. And so we're taking their doses off the top. And then we run a formula based on the rest of the doses that are available and distribute those doses based on county population, based on social vulnerability in those counties, and based on geographic equity, so trying to equalize that all counties across the state are getting close to the state percentage. And then, so that sets a certain target for each county, and then within that county, we look at the number of vaccinators who have requested vaccine and give them a certain percentage of what they have asked for. This is also modified a little bit by the conditions or the criteria we need to think about with Pfizer and Moderna and J&J, who has the right storage, how it's packaged and shipped. So I will say when it comes to Pfizer vaccine, it's shipped in trays of 1,170 doses. And so we try to allocate that to places we know have the storage capacity for those largest trays, and then which is largely health systems, but also some of our health departments and some other vaccinators have uber cold storage. And then we work with our hubs and break apart those trays into smaller sets of doses that go out to a number of other vaccinators. But I hope that's helpful in thinking through. Doesn't matter if we're getting 50,000 doses or 200,000 doses. It is the kind of formula and criteria we're using that we continue to evolve as we move through this vaccination effort.
Thank you for that. Let's give the next question to Katie Thorson, WXPR in Rhinelander.
Good afternoon. Thanks for taking my question. I was wondering, Oneida County is at about 78% of people in that 65 and older age group getting at least their first dose of the vaccine, but we're also seeing some of our local vaccinators say they've either gotten through their list of 65 and older or they're getting close to getting through that. So as we're hitting kind of that 80% of that age group getting vaccinated, I guess, does that give you, are you seeing that across the state? Does it give you insight into how difficult it's going to be to get the whole state to that 80% mark that you're aiming for? Obviously, we like to get everyone vaccinated, but I guess, does that give you insight into how willing people are to get vaccinated?
Dr. Schauer, would you like to comment on that question?
Yeah, sure. So I think it's really encouraging to see that we are getting close to that 80%. That's really a great piece. And we know that all communities are continuing to go towards that mark at little different rates. I think when we look at influenza vaccination, the 65 and older is typically the group that has the highest immunization rates. So we know that's good. These are folks that are really truly motivated. They are at higher risk. I think we do recognize that there may be challenges with some of the younger folks. They may not have as flexible schedules. And so vaccination strategies really need to accommodate individuals who may be working and can't get off or need nights or weekend appointments, things like that, or who may have a perception that they're not as at higher risk as others. And so I think we do still have a fair amount of work ahead of us, but I'm hoping that that initial, the success with the 65 and older is that individuals see that their parents or grandparents have received vaccine and that they're doing well and that they are feeling that hope and feeling that they have that that protection, and that they will continue to go ahead and seek out vaccination for themselves as well.
Thank you for that. The next question to Kent Wainscott, WISN in Milwaukee. Kent.
Hi, good afternoon. Julie, earlier you mentioned that you were keeping a very close eye on the rise in cases in neighboring states and the spread of the variant being particularly infectious to younger people. If you see a rise in the number of cases of the variant in Wisconsin among younger adults who aren't yet eligible for the vaccine, how would you respond to that?
Well, I think that's a great factor that we would take into consideration as we think about when we'd open up to the general public. I mean, we're not probably going to set more phases at this point in time. We're so close that the next phase we would do would be open to everyone that would include that younger population. But I think that combined, you know, with what Dr. Schauer was just talking about ways to motivate younger people, and you know, this presence of the variants could be a motivating factor for people who might not have considered the vaccine beforehand who would now. And so we'll want to be sure and get full information to all people so that they can make good informed choices about how to protect themselves and those around them. And we'll continue to focus on that as we move forward. I would say, Ken, another population to think about, and we have been throughout the vaccine campaign in close communication with the University of Wisconsin, is also thinking through our higher ed campuses and thinking through as we move to more generalized vaccination, how our campuses can help with encouraging vaccination in their students, which will be another key population to reach out to. So that is another example of a place that I think we will focus and work on as we move forward.
Thank you for that. Next question to Megan Hart, Wisconsin Public Radio. Megan.
Hi. More than 2.5 million doses administered is such a huge accomplishment, but we're still hearing from some listeners who are eligible, but they're struggling to either get an appointment or they're just unsure how to do it. What would you want those people to know, and where would you recommend that they start?
So I would recommend that they start at either our website and go to the tile that says vaccine, and then where to get a vaccine. And that area of our website includes a map that people can find all of the vaccinators in their community that have vaccine distributed from us, and there are links to websites and phone numbers for local vaccinators. Another way that they can access information about where they might find a vaccine in their community, especially for people who don't like the internet or don't have access to the internet, is to call our toll-free number, and that number is 844-684-1064. Again, 844-684-1064 is a toll-free number available to anyone who is seeking further information about where they might find a vaccine. And just want to make sure everyone knows we have people who speak a number of different languages available on that line as well. And so that's another important place that people can go. The other thing is, remember, I made the analogy of it's a 9-inning baseball game. We know every time we open a new phase that everyone who is in that phase would like to get vaccinated the first day or the first week. But just as, we heard, we're still working on finishing people who are 65 and older. We're getting, we've got nearly 80% of those folks done, but it's taken 2 months. And so I also just continue to urge patience for folks as they continue to call and make appointments or continue to check back. The last thing I'd say is we're expanding. The federal pharmacy program has expanded and will continue to expand. So checking out pharmacies is another great place to look for vaccine as well.
Thank you for that. Next question to Rich Kirchen, Milwaukee Business Journal.
You've been talking some about when things, what inning we're in and so forth. Robin Voss yesterday told Wisconsin Manufacturers and Commerce that he thinks that businesses should reopen their offices and end remote work by the 4th of July. What do you think of that kind of timetable?
Well, I think it's going to depend on how well we all do stepping up to the vaccine plate, in my baseball analogy. I think we'll have adequate vaccine, and with the infrastructure that we've put in place, we should be able to deliver vaccine at a level to get us up towards community immunity by July. And if we're doing that, and the other thing we have to monitor, as I've said before, it is both vaccine coverage and disease rates going down. And if we're seeing both of those things happening, I think we will be well positioned to be moving back into situations where we interact more fully in a way that we did prior to the pandemic. So, the president has said he's hoping for 4th of July picnics. Again, he is saying not mass gatherings for the 4th of July, but the 4th of July picnic with a gathering of friends and family in your backyard, and perhaps everybody vaccinated and therefore not wearing masks. So I think we'll be getting very close. And what I would really encourage from our employers, and we're seeing them step up and be great about this, is holding clinics at work sites, encouraging employees to be vaccinated so that we can come back to work in our regular settings. The encouragement of employers will be very important in getting us to that level of community immunity where we'll all feel safe interacting in that way.
Thank you.
You're welcome.
That is where we have to wrap up. We have gone over our time, so we want to thank Deputy Secretary Julie Willems Van Dyke, Dr. Stephanie Schauer, all of you for participating. I know there were a handful of reporters we did not get to. We apologize. Please reach out to DHS Media with your questions. And of course, continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. We want you to be safe and have a great afternoon.